In today's episode, we look at grit, a personality trait that shows passion and perseverance in the face of obstacles, difficulty, and distraction. Resilience and courage are other words used to describe grit. In our conversation today, we'll look at the role grit plays in program and career success. Let's talk about holistic success. Hi everyone, I'm Kelly Dore, co-founder and VP of Science and Innovation at Acuity Insights. Welcome to this episode of the Holistic Success Show. Here with me today is Derek Owens, Assistant Professor and Director of Curriculum for the Nurse Anesthesiology program at Murphy-Denning College of Health Sciences at Mary Baldwin University. One of the reasons that Derek's school chose to use Casper, the situational judgment test, was to ensure that candidates entering the Nurse Anesthesiology graduate program had the grit and resilience to get through a really tough program. Having been a graduate student myself and working with a multitude of health science programs, I cannot emphasize enough how deeply impressed I am that Derek and his team wanted to focus on ensuring that students had the skills that they needed beyond their academic readiness and performance for an intense program and a career like nurse anesthesiology. I really can't wait to dig in more to talk to Derek about what his program had in mind. Welcome, Derek.
Hi, Kelly. Thanks for inviting me, and it's an honor to be here today.
It's great to have you on the show, Derek. We really appreciate you taking the time. So let's get started. So, Derek, before we jump into the concepts of grit and resilience, maybe you can make sure that everybody's on the same page and tell us a little bit more about the Nurse Anesthesiology program.
Well, thank you. We are a 3-year, 104-credit bachelor's to doctorate program that's heavily science-based. We have 3 pharmacology courses, 2 physiology courses, a chemistry and physics course, and multiple other heavy science courses. Our applicants are required to have a bachelor's in nursing and spend at least a year working in an ICU prior to application. This year we had 135 applicants and we have 25 available positions in the class. When they graduate and pass boards, they will be performing anesthesia in hospitals and surgery centers or anywhere else anesthesia is performed. They also work in labor and delivery suites, placing epidurals and spinals for labor, for C-section. They also work performing procedures to relieve acute or chronic pain when it's needed.
Derek, this sounds, as you say, intensive program, 3 years, bachelor to doctorate, but for a really important role. I know so many times in healthcare, sometimes our procedures can get held up for access to anesthesiology. We know in some communities, they don't always have access as easily. This sounds like an incredibly important role to support the healthcare system and access to care.
So that was one reason we started the program in Virginia, was to increase access to care, increase the number of anesthesia providers. There's an anesthesia shortage throughout the nation and in Virginia, and we're really trying to improve access to care and availability for services.
Absolutely, because we know a lot of times, you mentioned labor and delivery, these procedures don't wait. So it's amazing the incredible training that you're doing, but it is a big undertaking for these learners. So we've talked about this program, which I agree is incredible and intense, but does require, something beyond just their academic preparation. So maybe talk a little bit about why it's so important for the students in your program to really have that grit and resilience that we alluded to earlier.
Well, honestly, it started with thinking about my own graduate school journey and about that moment that everyone goes through when they don't do well on an exam and they realize they're going to have to overcome something in order to succeed, and what that takes. When these new students first enter our program, they've done sciences before in their undergraduate prerequisites. Like I said, they've worked in an ICU, but graduate courses in physiology and courses in the practice of anesthesia are a different level. So a growth mindset and grittiness are key to their success when they encounter those issues. I really think they have to think of failure as a cue to work harder, not as a cue for stopping.
So we've talked about grit and resilience, and they're important. Are there other traits, non-cognitive traits, as they're traditionally called? Increasingly, I'm calling them durable skills sort of those foundational attributes that lead to success. So, what are you seeing for nurse anesthesiologists? What other attributes play an important role, just both for the students, but also their long-term career success?
Well, I think both for when they're in school and when they graduate. So after they graduate, nurse anesthesiologists are going to work in many environments which require cooperation and the ability to function as a team. The operating room has surgeons, surgical technicians, nurses that all have to work together with many different personalities and different goals and decisions that have to be made that require empathy and judgment and critical thinking. So with this in mind, I really want to teach my future colleagues who are just good people and with empathy and the ability to communicate. Those are the people that I really like teaching. The person who will become that type of anesthesia provider is the applicant that I'm looking for.
Absolutely. That makes so much sense because we know the importance, not just for the team and the patients, of having not just somebody who has the knowledge or the technical skills, but also has those other attributes um, to make them that really key person in the team and to their patients' health and success. So, knowing that these attributes are important for nurse anesthesiology, there are a whole bunch of different ways historically in academia that we've tried to measure these things. They have varying reliability or predictive validity, but maybe you can describe a little bit about what your team was doing before you adopted Casper. Were you using other metrics? Were you just purely focusing on academic? What were you trying to do before that, before Casper?
So basically, before Casper, we depended on a combination of GPA and interview to catch any traits that would make someone unsuccessful.
You were focusing then primarily on a GPA metric or hurdle, I don't know which you were using, to determine who could come to interview, which is a very
Right.
traditional model.
Right. So traditionally, we looked at science GPA and overall GPA and utilized that in order to invite someone for an interview, and then utilize the interview to see who got into the program.
And what were the gaps that you were seeing with that process? So what was sort of some of the limitations? Why did you look for something else?
I think it's that holistic view. And back to my original thing was I thought about my journey, and I don't know that I had the best GPA, but I feel like I did a great job in school and in practice afterwards. So that maybe the GPA wasn't the tell all or end all, that there was more to it. And there's
Absolutely. That's a conversation I have with a lot of people. Exactly what you just said is that need and that desire to take a holistic look at somebody earlier on. So you're not removing them from eligibility solely on that academic number, which can be influenced by a lot of factors depending on our own life experiences and pathways. Maybe we were holding down a job, maybe we had to take some courses or had some professors in university that maybe weren't aligned to sort of what we needed in order to get through that class. There's a lot of different factors going on. And so I love that you were conscious of trying to build that a little bit more robustness. Now, importantly, and what I think is great is that you didn't take it as okay, we should eliminate the interview, which is similar to what a lot of folks do. They keep the interview. And I'll take this chance to sort of highlight the fact, because as the co-creator of Casper, I get asked this question a lot, that Casper is meant to complement the interview. The interview is something you can't run, whether it's asynchronous or in person or online. It's not something you can run for all of your applicants. I'm sure, Derek, you can imagine trying to interview every applicant you have. Right. That's just not something you're resourced for. And so it's if you can get a much more holistic picture earlier on and then use that interview to supplement. I appreciate the fact that you sort of really leaned into building that more holistic, robust process. Maybe tell me how you're using Casper in your process to get a holistic view of your applicants beyond that academic piece. What are you sort of using?
We were using it as part of the criteria to invite them for an interview. So along with their science GPA and their overall GPA, use it as part of that criteria. And then we also then interviewed them and could use that as part of the criteria, so that it was a combination of all those things together. You said the word holistically, which makes me, that's the buzzword these days, right? As everybody says, oh, I'm doing a holistic interview, which I love, but I've asked people, what does that mean? And people start going, so I just thought about, to me, what it means. And I thought, to me, it means looking at more than just the GPA and looking at them as an overall person. And do you have the resilience and the grit that when things get hard, that you'll keep working? And I think that's hard to find in just the GPA sometimes. I think, so the way I ended up structuring it, look at it was, and the way my team and us and the whole university was, we're going to look at your science GPA. And if you have a great science GPA, I'd like to interview you and talk to you. And if you have a great Casper score, I would like to interview you and talk to you. And in the middle, if you were somebody who had a okay science GPA and a pretty good Casper and pretty good other things, then maybe you're that person that's going to keep working and succeed. And really, I think that's overall what I'm looking for in the end was, will you succeed? Will you be someone who's going to succeed and add to the profession?
Derek, I have to commend you and your team, because it's far too easy to fall into the lull of the buzzword, of the term that everybody's using. Okay, so if I just add this term to, say, my admissions process or my interview or my pre-interview selection, then it makes it good by definition. What's so important that you and your team have done is constructed a process that makes sense for your program, it makes sense for your mission, and it makes sense for your students. And I think that is like truly an incredible trifecta to have, like, work to build. And it takes time. It's not an overnight magic wand that you wield. But I love the thoughtfulness that you're taking to that.
Well, I only hope to improve. The same thing we're talking about that I'm asking for in my students is, I want a growth mindset and I want resilience. So I guess the best way to get a bunch of students to do that is to model it yourself. So I assume this will change and get better and grow as we continue the process. But we'll see how all that goes.
Absolutely. Well, incredibly admirable. Derek, I really want to thank you for joining us today to talk about what it is that your program's trying to do and the process of trying to get there too, because I think it's daunting and some folks, don't even know where to begin. And what's important is that you start, and sharing that journey is so important.
Thank you, Kelly. Thank you for having me, and thank you for talking about this with me. I love this topic.
Me too. Me too. Hopefully we'll have you back to hear how things are going. Would be a real pleasure. So to all of you, thank you for watching and listening. If you haven't subscribed to our show already, please do so and share the episode with colleagues who you think might find it useful. And with that, we will catch you in the next episode. If you enjoyed this episode of our show, please be sure to check out the other episodes. And don't forget to subscribe. We have a new episode releasing every week.